station, check out your equipment. You don't really see a prompt. It's just a
Oxygen administration. This is the KCC skill sheet. Take proper BSI. And then we would say something like scene safe, but mostly BSI, PPE, so mask, face shield, and gloves because I'm dealing with the airway. So I gotta check out my equipment, make sure my tank is operable. The color scheme is green, oxidizer, placardine. I have my oxygen regulator assembly, my pressure gauge, covers a flow meter, and I have the yoke on the top. It lines up with a pin and index system. There's a washer in place, and so I line this up to make sure that it all fits. Now to prepare the tank, I want to make sure that the opening is clear, and I'm going to open this up real quick to just purge some of the dust that might be in there. No flames, no petroleum-based products or lubricants. So I'm going to be getting ready to administer oxygen. As I look at my oxygen bag, make sure that I have all my BLS adjuncts, my NPAs, OPAs, have my passive flow devices such as a non-emitter mask and nasal cannula for the different sizes, and a bag valve mask and a nebulizer, one for the mask and one for the T-piece. So I go ahead and connect up my regulator. I go ahead and open up the tank now, all the way open, turn it back, quarter, turn, making sure that my pressure gauge reads an adequate volume in between 500 and 2000, and I don't have any leaks.
Okay. You are dispatched to a difficulty breathing case. Upon your arrival, your patient is unconscious with slow and shallow respirations. A carotid pulse is present.
So slow and shallow breaths, I'm watching rise and fall. I go ahead and open the airway, maintaining that I have a pulse, and I'm listening to the respirations. I'm gonna use the tongue, jaw lift, and insert an OPA. And then I want to start ventilating my patient with the bag valve mask. So I can get a breath at one breath every 5 to 6 seconds, 10 breaths per minute to see adequate rise and fall. Now that I have adequate rise and fall, I can go ahead and connect up my oxygen tubing to the regulator and connect this up to high flow 15 liters. Go ahead and make sure that I have a pulse and that the patient is still breathing and has a pulse.
The patient is gagging and becomes semi-conscious.
So I go ahead and take the pharyngeal out in line of position. Go ahead and measure my nasopharyngeal, use it on the right side. Lubricate this with a water-soluble lubricant. I put the bevel towards the septum and introduce the nasal passageway or MPA to the right there, and continue to ventilate my patient to maintain an open airway.
The patient is fully conscious, has an adequate tidal volume, and a pulse oximetry of 87%.
So I'm going to continue ventilating the patient, and he has a pulse ox at
87%.
87. So high flow oxygen is being provided. One breath every 5 to 6 seconds, 10 to 12 breaths per minute.
Pulse oximetry goes up to 93%. And the patient is fully conscious.
So now my patient is arousable and probably doesn't want the mask and is not tolerating this positive pressure mask. And doesn't like the nasopharyngeal airway. I'll go ahead and continue placing the patient on supplemental oxygen. I could choose nasal cannula or a non-rebreather mask at this time. I guess, what is the SATs at?
93%.
93, so that would indicate that I would want to do a little higher flow, 15 liters. Inflate the bag, go ahead and place the mask over the patient's face, strap around the patient's head. Make sure there's a proper seal, the mask to face. Monitor my patient's breathing. Should he start to be irritated with the nasopharyngeal airway, I'll just have that removed.
Okay, Now an ALS unit arrives. Paramedic states hearing wheezing and rhonchi in the patient's lungs and asks the candidate to set up a nebulizer.
Okay. So we want to differentiate between using a mask and nebulizer treatment or a T-piece. So we could decide to use a T-piece by putting the medication into the acorn and setting this at 6 to 8 liters and administer it with the T-piece. If the patient cannot tolerate holding the T-piece, then we can go ahead and use a simple mask like this. And administer the medications such as albuterol and atropine into this acorn. I'm gonna remove this mask from my patient's face for now. I'm gonna connect up the nebulizer with the medication already in there so that it starts missing. Adjust this to 6 to 8 liters. Gonna take off the non-rebreather portion and then continue to have my patient breathe normally with the nebulizer treatment. Again, secure it in the face mask over the patient. Monitor my respirations, lung sounds, and pulse oximetry.
Your patient still appears agitated and still has a SpO2 reading of 93%.
So the person does not seem to be tolerating the oxygen in a passive flow. Pulse oximeter is low. We're going to have to now assist the breathing. So we'll take the mask off. We can then continue by using something like this device, where we would continue to attach this to our face mask and this end to the bag valve mask. We would keep the oxygen basically onto the nebulizer treatment. And I could then connect the oxygen from the bag valve mask to my oxygen tank. If I had another oxygen port, I would continue to breathe for the patient at 1 breath every 5 to 6 seconds, or 12 breaths per minute.
And paramedic states that you should put a nasal cannula on the patient.
So I assume the patient now is getting better, and the treatments that we've been giving to open up the airway has done its job by reducing the bronchospasm. Patient is breathing spontaneously, I assume, and so we can discontinue the oxygen by bag valve mask and set this at a liter flow rate of 2 liters or 4 liters. What was the order?
2 to 6.
We'll go ahead and start off with 3 liters then, slightly above the 2. Tab down, nasal prongs follow the normal passageway of the patient. We're going to put the tubing around the ears and then draw up on the drawstring portion under the chin. Making sure we're at 3 liters and watch our patient's respiratory effort, rate, and rhythm.